Happy morning, students. Welcome to RJR Academy. This is biology session. Welcome me back. Yes. All right. We'll begin with a new chapter today. Today we'll start with reproductive health. All right. So far we discussed in the previous part, if you see, we discussed about the sexual reproduction and flowering plants, like the botany sectors that we have completed. Now we move to the zoology part, that is in reproductive health. We'll start with this particular chapter. Hopefully, today we try to complete this particular chapter because we have two sessions. The reproductive health can be completed by today, right? So I hope you people are doing enough and sufficient practice at home, and you're making use of this lockdown period at home and making use this period at the time effectively at home. All right. So we'll begin with this chapter, the reproductive health. So let us have bulletins. What are the things that we going to discuss today? Okay. We discuss about the reproductive health, the introduction part, and then we move on to the RCH, that is RCH package, the reproductive and child health package. Reproductive and child health package that we're going to discuss. And then we'll discuss about family planning techniques, and then population explosion that we'll discuss. In that, we discuss about the mortality rate. It's especially infant mortality rate, maternal mortality rate, birth rate, death rate, the reasons for population explosion, what are the effects that we come across in population explosion, how we can overcome this population explosion. In that, we discuss about the family planning techniques, where the barrier techniques, the natural techniques, artificial techniques we'll discuss. In that, we'll discuss the lactational amenorrhea, right? A couple of things that we'll discuss, the barrier techniques and artificial techniques, also like contraceptives, IUDs, especially intrauterine devices that we're going to discuss. Once we complete with this, we'll discuss about the pills, the injection parts, right? The contraceptive, the ideal contraceptive techniques, where we discuss about Saheli, and then we'll discuss about the medical termination of pregnancy, that is induced abortion, that we'll discuss. All right. And after this, we'll discuss about ART, assisted reproductive technologies, where we discuss about in vitro fertilization, the test tube babies program, and ZIFT, zygote intrafallopian transfer, gamete intrafallopian transfer, intracytoplasmic sperm injection. These are the artificial insemination. These are the couple of techniques that we're going to discuss under assisted reproductive technologies. Okay. Once we're done with this, the last part we discuss about the sexually transmitted diseases. That is actually the important part, how the sexually transmitted diseases, which spreads, how we can minimize it, how we can prevent it, right? And amniocentesis. These are the couple of things that we're going to discuss. Hopefully, we'll try to do a justice for this particular chapter. So, good morning, everyone. And the disclaimer is, this chapter, the reproductive health, is we're going to discuss purely on medical grounds, right? So there will not be any bad things that we're going to discuss. It's all medical content that we're going to disclose, and we're going to discuss all about medical terminologies. So stay tuned and let's begin with this chapter, that is reproductive health. Shall we? Can we start? All right. So the reproductive health, the first thing, we'll start with the introduction for the reproductive health. We'll start with the World Health Organization. The World Health Organization, what they proclaimed about this reproductive health. So as we know, health, we discussed in the human health and disease, health is something not only physical fitness, it's emotional, it's on all basis, a person supposed to be healthy. That is what actually the definition that we discussed about health. But here, the reproductive health is concerned, which was given by the World Health Organization. The WHO means, it means the society with people having physical and functionally normal reproductive organs. Because we're talking about the reproduction here, because the next chapter we're going to discuss about the human reproduction. But here we're talking about the reproductive health, where physically the person must be fit and functionally in the normal reproductive organs and normal emotional and behavioral interactions among them, in all sex-related aspects is called the reproductive health. This is what actually we call it as reproductive because we are connecting the health with the sex-related things here. So the World Health Organization has clearly given the definition is the emotional, the behavioral interaction because the emotions and behavior of the person has something to do with the reproduction. So in all sex-related aspects, this health is called as reproductive health. This definition is given by World Health Organization. So this is what the definition about the reproductive health, right? What is the reproductive and child health care? We call it as RCH. Sometimes they'll ask the expansion for RCH. RCH stands for the reproductive and child health care. So this RCH, the programs, what are the main objectives of the RCH? The RCH, which mainly creates awareness, which creates an awareness among the people actually. So what are the main objectives and what basis they create an awareness among the people that we're going to discuss? The first and main objective of reproductive and child health care. So you need to clear with the expansion of RCH. RCH stands for reproductive and child health care. Okay, the name of the chapter is reproductive health. We're talking about the reproductive health. Okay, the first and foremost, the main objective of RCH is which provide facilities and support for building up healthy reproductive society. So they not be like physically they're not, of course they're healthy, but reproductively the society should be healthy, right? So that is the main objective of this RCH. They provide the facilities, the infrastructures, the medical facilities, like the supporting facilities, like healthcare workers, like doctors, the providers, pharmacology, like diagnosis, right? Family planning, the lot and lot of things like they must provide the facilities and support for building up healthy reproductive society and people participation through voluntary agencies. There are voluntary agencies, opinion leaders actually because they also collect opinions from like the various people, like the opinion leaders and government functionaries, like not government as well as like non-government functionaries. They get the suggestions from the people, especially about the reproductive health. Okay, and the usage of mass media. So how we're using a mass media, maybe you go for Twitter or Facebook or you go for Insta, anything that you do it, like what type of like post that you're doing it. So they must use the mass media like radio, television, newspaper, magazines, posters, like by these all means like they're supposed to give a proper and healthy information to the society so they can gain information. For example, you take a sex education. By this class, like 12th standard, you're studying this particular chapter because this particular program, like a reproductive and child health program, like even NCRT has given this particular unit so that the sex education seems to be important for the students because at this level itself, like you must learn what are the actually like reproduction is all about, what is the reproductive health, what is actually like pros and cons that you should study. So you must be knowing about the basics of this reproduction. So sex education is again is like important at this age because you're in adolescent age. At this age, you must be like knowing like all the plus and negatives, like because you should not die out of ignorance. So these are the main objectives of reproductive and child health care. Okay, so in this particular chapter, you get like 2 to 3 questions from it, especially you get from this particular chapter, reproductive health. May comes like three questions you may get. One definite question which you get from like IUDs, like intrauterine devices, you may get one particular question. So one question you get from IUD and other question you get from ART like assisted reproductive technologies that you get. And other one is like barrier, maybe like sterilization technique, like physical barrier or like artificial techniques that So from these areas, like or you get question even from RCH also, like so you get 2 to 3 questions, especially from this particular chapter. Okay, so 2 to 3 questions that you can expect from this, yeah, you can get from this thing actually. Okay, so now we move to the next part. RCH package, that is reproductive and child health package. What are the components of the RCH? This comes as a package. The government has given the package for this. What are the things? Here, the child survival and safe motherhood. That is very important. So mother and child supposed to be like safe, even like obstetrics and gynecologists, if you see, they consider like the health of not only the mother but also the baby. So mother and baby supposed to be safe So the child survival and safe motherhood component, we simply call it as CSSM. So CSSM, fine. Then family planning. So family planning also is like the main component, the thing which comes under RCH package. And the prevention and management of, or that is like reproductive tract infections, or simply we call it as RTI, reproductive tract infection. STD, what is expansion for STD? Guys, tell me what is expansion for STD? STDs are like sexually transmitted diseases, or we call it as a venereal disease, or also we call it as VD. VD stands for venereal diseases. Sexually transmitted diseases, like example, if you take a sexually transmitted, can you give few examples for sexually transmitted disease? One among the viral infection that is called AIDS, that is acquired immunodeficiency syndrome. Can you give few examples for the sexually transmitted disease apart from AIDS? Can you give me few examples? So what are the examples that you can give? Apart from AIDS, we have examples that you take, gonorrhea. You take a gonorrhea, you take syphilis, you get chlamydia, that is chlamydiasis. Then you take herpes zoster, right? These are like even sometimes hepatitis, that is also like which comes under the sexually transmitted disease. You need not worry. At last, we're going to discuss about the various sexually transmitted diseases also, right? It caused by mainly by the bacteria as well as by the viral components. So we're going to discuss about the sexually transmitted diseases and AIDS as well in this particular chapter. Then client approach to the healthcare. So healthcare approach, where the target-free approach, like they should not be very specific or only one particular society. They must be having the broad spectrum. So they should cover like entire area, like irrespective of whether they're rich or poor, whether they are like downtrodden or like whatever the people, like any caste may be, like this package should reach any people without any hurdles. Okay. So next we move on to sex education. Now we are studying about this particular chapter, the reproductive health. There are many questions, the controversies which comes. Is really the sex education is important in schools? Like why we have this particular chapter? So for that we have answers from this particular slide. The sex education. Why we are studying this chapter? The reproductive health, right? The sex education. What are the main objectives of the sex education? So eventually at the end of this chapter, when you come to the end of this chapter, what will you'll be learning after all? So in sex education, the main objectives are, so what are the main objectives of sex education? Why this chapter has been included by NCERT in your textbook? The answer is, this is to provide the right information to the young, because you are in adolescent age. At this age, you cannot justify, you cannot take any conclusion, you may not take any decisions, but this gives the right information to the young and the discourage children from believing in myths and misconception about sex-related aspects, because you may have a lot of doubts, but what you be doing? You may not be approaching your parents, but you go and approach your friends, because your friends may not be having a sufficient information, or he or she may not give the correct information about what the queries is all about. So you should be very careful where you have any queries or anything that you need. You should be like stay away from believing in myths and misconceptions about the sex related aspects. That is very, very important, because if you're in adolescent age, you're not mature enough at this age. If you go and approach any other boy or a girl or your friend, like this myths or unbelief, like it may take you wrong route. So you should be extra cautious in this case. Then adolescent age should have the proper knowledge about reproductive changes, because this is the age, like the physical changes makes breast enlargement, secondary reproductive, like secondary sexual characters, change of voice, like change of the body aroma, I mean the smell, like sweat, like a lot of things that may change like this. You should not get panic or why this type of physical changes which is happening in my body. For that you must have the sex education. And STDs, like how the sexually transmitted diseases which spreads, this also should be extra careful. So STD and hygienic practices. So you should be hygienic, and the sanitation and hygienic, like at the time of especially the females, like after times the puberty, right? They should be extra cautious, and they should be aware of like hygienic and sanitation. So hygiene and sanitation, which plays a very important role. For that, sex education is important again. Then education also given to couples regarding birth control options, not only for adolescents. The sex education also given for the couples also. For example, newly married couples, they want to have the space, like they don't want to have a child immediately. They can have a space in between. So for that, they should be aware what type of contraceptive, whether they can go for a barrier technique like natural technique or artificial technique, or they can go with the intrauterine devices, or they can use for they for eventually go with the sterilization. So this type of like proper counseling, proper like information, that has to be given to the couples also. So sex education is also given to the couples regarding the birth control option. For example, perhaps they want to have the space in between the kids. Actually, they already have the two kids. They want to have the space. So what type of, for example, copper teeth, or they want to go with the Saheli pill kind of thing, or they want to go to the hormonal control, or they want to go to the non-medicated IUDs. So what type of the prescriptions, the medical providers, the doctors which are going to recommend. So the sex education is again going to be important for the couples as well. Then educating the pregnant mothers, not only for the couples. If the mother should become pregnant, then the postnatal care, the breastfeeding. So you know pretty well, like the first 6 months, the mother should feed the neonate, the newborn. So breastfeeding. So what are the importance of the breastfeeding? That has to be given properly to the mother, because breastfeeding, we already discussed in immunology. Breastfeeding, which plays a very important role. Can you tell me, why the gynecologist prescribe mother to feed the baby minimum, at least like minimum for the first 6 months after the birth? Can you tell me the reason why the breastfeeding is essential? We discussed already, like in the immunology part, the colostrum that we discussed. Why gynecologists prescribe mother to feed a baby for the first 6 months of time? Yeah, this is because where you could see it's quite rich in IgA immunoglobulin, that is secretory immunoglobulin, and also it's quite rich in what? All the minerals, all the essential nutrients that is being given through the milk, and also this is going to confer immunity, because the first 6 months the newborn, that is neonates, won't be having the immunity in a body, where the mother's the breast milk, like the milk is going to offer, going to give the immunity for the 6 months of time, because the newborn, the neonate, will be acquiring the immunity only after 6 months of time. So the breastfeeding is quite essential for the first 6 months of the time. So this gives actually immunity for the newborn, because newborn is called as neonate, right? So for that, the mother should be given proper guidance, stating mom should feed a baby on regular basis, at least a minimum of 6 months of time, and male and female child given equal opportunity. We could not discourage, and we should not believe like female child is not like good, only the male child is good, right? Female infanticide, these all practices should not be followed. So male or female, any child, both the child has to be given with equal opportunities, both the child has to be treated equally. There should not be any discrepancies, there should not be any partiality between the male child and the female child. And conscious health family, they should be extra cautious and conscious, the family, the planning is very, very important as far as sex education is concerned. And awareness of uncontrolled populations, what will be happening like if the population is not controlled? Can you tell me what is today's population? What is India's population today? As far as today's date, 29 July 2020, what is the population of India? Because India is the second largest population, right? So what is the population of our country, India's population? Because as you know, like India, which comes like 17.7% when it comes to the world population, complete world population, India ranks like 17.7%. India is in second position. Can you tell me what is actually the current today's population in India? Today, day 29, 2020, what is the population of India, for country? Because India is the second largest populated country. Okay, what is the population? So this reached actually 1.39 billion. So the population is today, especially as per date today, the Indian population is 1.39 billion. I'm talking in billions. Okay, so this is what actually the population explosion is all about, right? So here the sex education is also giving awareness to the uncontrolled population. We're going to discuss about what are the ill effects of the population explosion. Population increase ஆயிட்டே இருக்கும்போது என்னென்ன விளைவுகள் ஏற்படும் அப்படின்றதையும் we're going to discuss in this part, right? Drug abuse, because in this part, like in adolescents, like should be extra cautious in taking drug. Many people, they get addicted with the drugs, they cannot withdraw back from to the normal position. So they should be extra cautious, with the drugs, what type of drugs they take, like, out of, like, curiosity, out of, like, stimulation by your friends. You should not get into trap by means of taking some drugs or steroids or something like that. So sex education also giving a solution, also giving the proper precautions, like, about the drug abuse also, right? Sex abuse and sex related crimes, actually. So nowadays the sex related crimes, the rapes, like a lot of issues being happening, right? You would have, if you open a channel, if you open a social network, you can see a lot of things that is coming, like, it seems to be weird and you should not take it. How things happening very badly, like, sex related crimes are like started increasing nowadays, right? So the sex education, which is giving the full stops, or at least giving some solutions, like, stopping the sex related crimes, actually. Strong infrastructure facilities, also the sex education in hospitals, or like in any providers, anywhere you go, or healthcare programs, anything you take, whether it by World Health Organization or by like RCH you take, this gives the strong infrastructure for facilities. Professional experts, they should be professionals, like, like, normal people cannot do it. Even you take tablets, even you take, like, IUDs, you take any suggestions that you want to take, like, you need to take under the guidance of the physician. I mean, like, bona fide, registered general physician, or like from the doctors only is supposed to take. And the material support and massive child immunizations after the birth, like, what type of like vaccines that has to be given, right? You would have still a first booster, second booster, third booster, polio vaccine, I mean MMR vaccine, BCG vaccine, the hepatitis vaccine. So different types of the vaccine, the immunization chart that, which is being given to the parents, like, so this sex education also giving the massive child immunization, which can protect the child, right? So this is also very important. And statutory ban on amniocentesis for sex determination. You know what is amniocentesis? Amniocentesis has got both positive as well as negative, right, aspects. There are two sides of the coin. What are the positive side of the amniocentesis? Amniocentesis, where we just find out anything like an abnormal chromosomal abnormality or chromosomal deformities, anything that is actually which is happening there, then we can find out by means of amniocentesis. But amniocentesis by which we can even find out, like, the sex of the fetus, actually. But it is a ban, it is a ban, it is illegal. We should not reveal the fact, the providers, the doctors, by means of ultrasound, like in amniocentesis, we should not reveal out the fact whether the fetus is like inside is a male or a female. As per law, it is banned, actually. So, but in positive aspect of amniocentesis, where you see the amniocentesis, we can do the karyotypic technique, where the chromosomal abnormalities, anything like, deficient in the chromosomes, like Down syndrome, cystic fibrosis, you take sickle cell anemia, right? This type of, like, chromosomal abnormalities that you can even identify, where this sex education, which gives the statutory ban of amniocentesis. Okay, fine. Okay, so it's all over, like, mostly, like, it's a worldwide, like, it's banned, actually, amniocentesis. But a few countries, like, it's not a statutory ban. But in India, it's completely, it's banned. Amniocentesis is banned, where disclosing the sex of the fetus, like, it's in the mother's womb, whether it's a male or female, it's a punishable act as per the government of India. So amniocentesis, by means of amniocentesis, the ultrasound techniques, the providers, the doctors, the technicians should not reveal the fact whether the fetus is a male or a female. Next, move on to the population explosion. Coming to the population explosion. Okay, fine. Coming to the population explosion, as I told you, right, we have, like, the first, the largest, the top 10 countries with the largest, the total population, where the China ranks first, where you could see in this case, but at the time, like, it is 19.2 percentage. India ranks the second percentage. India comes like 17. So on the world population, the percentage of the world population, you could see the India comes like 17.7 percentage, which ranks, like, in the second position in the world population. But today it's coming approximately, by today it's like around 1.39 billion approximately, the Indian population. So India is the second largest country. When you talk about, when you take the list of 10 countries, where you could see the India is second, United States, Indonesia, Brazil, Pakistan, Nigeria, Bangladesh, Russia, and finally you could see the Japan. These are the top 10 countries when you take the largest world population. But when you take the statistics, when you take this diagram where the bar, this start increasing, the population start increasing right from 2010, when it reaches, like, 2 or 2020, see the numbers like, this start actually like going exponential. It starts, increasing. There's no way the population, it seems to be decreasing because of like increasing health facilities, decreasing in infant mortality rate, decreasing in maternal mortality rate. There's also like, many of the reasons why the population explosion takes place, because gradually the death rate has started decreasing, the birth rate start increasing, and more of the health facilities, healthcare units, hospitals, like, all the, the diseases is getting diagnosed in the early stage itself. We're getting cure for everything. So the population started like explode, and it start increasing substantially year after year. Okay, so now we move on to the next part. Population explosion. What are the effects of uncontrolled population explosion if the population is getting like increased day by day? So you can ask me, sir, why we are discussing about the population explosion? Because we're going to talk about the solution, how the population explosion can be stopped, at least can be minimized, or like, which can be brought under, which we can bring under the control, right? So for that, we need to understand the population explosion. What are the effects? If the population explosion, if it's going beyond control, it's not controlled now. Poor education. So for example, in a family, the parents have got like, 6 to 7 kids or 5 kids, right? They cannot give proper education. So this comes like 15%. The pie chart shows they cannot give a proper education to the child, where the poor education, and increase the cost of living. You would have like experiencing now, like, what would be the cost like, 10 years back, and what is the cost of like, just you take a milk packet. The cost of living is gradually is increasing day by day. What is the cost of petrol, right? Then you take like, 15 years back, and what is the cost of like 1 liter petrol today? So everything is gradually. What is the cost of the gold? If you take like, if you just go for 15 years back, what is the gold? The cost of the gold now, like, 1 gram of gold you take. But there's a reason, right? Because this is because of the effects of the uncontrolled population, where increase the cost of living. So increase the cost of living, and it will be the extra burden. For example, if the lower middle class family or the middle class family, if you take just an example, this, it leads to the stress to the head of the family, maybe a father or a mother, like, now they're in a position to go for a job, like, both father as well as the mother, they're in a position. But those days actually only father goes for job and a mom should take care of a family. But because she usually is like homemaker. Now, if there are like 4 members in the family, the adults, all the adults supposed to go and earn something, only then they can run the family. I hope you can understand the situation. The reason, why the reason, this because of uncontrolled population. This is one of the bad effects that you could see. This leads to the family stress. You would have seen now in this lockdown period, like, how many people they lost a job. Definitely, like, this gives a lot of stress for the parents. This will give a lot of stress for the household. So they cannot manage the family. This eventually definitely give the stress to the particular family, right? This is what, right? Then malnutrition. They cannot give the proper nutrition for the child, because there are 5 child in the family. Like, they don't have a gap between the child, and they're moreover the lower middle class or poor class, or if you take the middle class as well. But they cannot give the proper nutrition, because only one person is working in a particular family. Like, he cannot fulfill the needs of the all the 5 children in the family, right? Especially in this type of tough situations you take. So malnutrition is also like main reason, and health complications. So health complications may also rise due to the uncontrolled population and overcrowding. The 10% you take, this leads to the overcrowding, because you take like, all apartments, multi-story buildings, like, nowadays it started increasing, where the people were living like, just like 5. Nowadays today you could see like 500 people have gathered in a particular place. The scarcity of food, scarcity of water, scarcity like a loss of job, opportunities have been declined. So this started like, then things like, pollutions, like, this started increasing, like, happening a city like, Chennai, the Chennai, Bangalore, Delhi, Bombay, that you take. This is actually which is happening, where overcrowding which takes this in the particular thing. And so this is also like, for agricultural production also, because they are in position will be in the to produce more of agricultural crops, where they need to go for genetically modified crops, right? Lot of manipulation have to do. Then the gene manipulation techniques will come. So they need to fulfill, because those 50 years back you take, like, the population was less. But now, like, we need to like harvest more. Even the agricultural sectors also has to increase. but those people, they'll not get the rain on time due to the famine. They cannot fulfill the needs of this much of people. So then definitely this leads to drought condition and leads to famine for the people. So this is because of the uncontrolled population explosion. It's just not only with one family we're talking about. Just imagine you're talking about a state. Just talk about, like, our country itself. When it comes to the whole country, this leads to, like, the bad situation where the world population, it seems to be uncontrolled, where this because of overcrowding, and it increases the crime rate. Why does the increase in crime rate? Even the delinquent child, like, even 16 plus, 15 plus, or 14 plus child, they'll be like stealing something because they want to survive, right? So what happens, like, this leads to increase the crime rate. If you see, a lot of criminals, they started, beating up, it started developing because of the uncontrolled population, because they want to survive, because they may not have job, and they'll be continuously, like, doing, and they may falling into, like, wrong practices. So these are some of the bad effects that you could see because of uncontrolled population explosion. Okay, possible ways of mitigating population explosion. So what are the things how we can compensate this problem? We can do by means of jobs, like, we can try to increase the jobs in the government or, like, non-government sectors, the private sectors. We can try to increase the jobs, right? Even nowadays, you could see, like, how many people they lost the jobs actually because of that. They lost, like, financially they drop down. You would have seen, like, many of your cases, like, you cannot come out of your home. Your parents may not go for a job, like, because of that. What happened, like, they cannot run a family. So jobs of 21 percentage, mass education. So they can give the mass education. For that only, you're being given to this particular chapters, like reproductive health. You must be knowing, like, why we are studying this particular chapter, because you are playing very important role as far as the development, as far as the welfare of our country, like India, right? So mass education is also, like, very important. And refugee homes, where, like, 3 percentage. Then family planning. Family planning is like 25 percentage, like majority, you could see, like 25 percentage of family planning. So one point of time, like, amdo amare do. So those days, what happens, like, nam iruvar namakku iruvar. After that, what happened? Nam iruvar namakku uruvar. So what happens, like, now what happens? The families, the size of a family is getting shortened actually, because they cannot fulfill the needs of the children. So family planning techniques, which plays a very important, and they should be, like, extra cautious, like the whom they should ask. That is what actually the problem comes. Sometimes the newly married couples of, like, after 2 children, they may not be having actually position. They don't have the knowledge or the education, the sex education, like where they should go and approach, to whom they should go and approach, or what type of family planning technique, whether temporary or permanent, whether they can take the IUDs, what type of IUD they can take. So this type of, like, confusions may come. For that, they should go and meet the doctors. The doctors will give the correct solution for this type by means of the family planning. Next, we're going to discuss about this type of contraceptives only. It may be natural or it may be artificial, that we're going to discuss very shortly. And it encourage agriculture, because agriculture, which we cannot underestimate agriculture, because without agriculture we cannot survive. We cannot, like, earn, like, millions and millions of dollars. But if the agriculture goes down, like, agriculture is actually like backbone for country. The agriculture is not, if we're not encouraging agriculture, we're doing, like, keep on constructing multi-story building, we cannot eat currencies. But we only eat rice, right? So we supposed to encourage agriculture, right? Agriculture, and the rural development has to be taken for account, and equity. These all, like, the possible ways of mitigating population explosion. Okay, fine. So we're done with this population explosion. Effects of the population explosion. What are the effects, guys? Can you tell me what are the effects of population explosion? Overpopulation. So you would have seen, like, overpopulation. Then the second thing is, like, unemployment, loss of jobs. Many people, they'll lose jobs because of the population explosion. Then illiteracy. They cannot give the education for all the children. Like, people, the child will become illiterate. If the child will become illiterate, everything will drop. Like, now the country will doom. So because the country stands only by literacy, the literacy rate goes down. If the effects of population, like, the population explosion start increasing, if you're not controlling it. Then poor health, we cannot feed the children. Many people, you could see the begging on the streets, like, you would have seen, like, in front of your eyes. But you people are blessed, because many people, like, they beg just not for, like, education, just they beg for a food for one particular time. So the poor health, the malnourished condition, these are some of the effects that you could see in this case. These are some of the effects for the population explosion. Okay. Now we could see birth control. So for why I just thought you what are the எதுக்காக நம்ம இவ்வளவு நேரம் இதெல்லாம் population explosion பத்தி நான் முன்னாடி உங்களுக்கு சொன்னேன்னா you should understand why we are studying this particular chapter. Reproductive health நம்ம எதுக்காக படிக்கிறோம். It's not just to gain a marks. You must be aware of what is necessary for studying this particular chapter, the reproductive health. Now we're going for family planning, but I told you how we can have a family planning. What are the methods by which we can have a family planning that we're going to discuss here. Okay, fine. First, you see the methods of the birth control, the natural methods. We have two types like this. Natural tech methods, artificial methods. There are two types of methods that you can see as far as your birth control is concerned. The first is actually we talk it as a natural method. Naturally, எந்த விதமான artificial techniques எனக்கு வேண்டாம். If the couples they've chosen, சார் எங்களுக்கு வேற ஆர்டிஃபிஷியலா எதுவும் வேண்டாம், எங்களுக்கு கான்ட்ராசெப்டிவ்ஸ் டேப்லெட்ஸ் இந்த மாதிரி எதுவும் வேண்டாம், நேச்சுரலாவே நாங்க ஐ ஜஸ்ட் வாண்ட் டு ஹேவ் a space between the child, எங்களுக்கு இப்போதைக்கு குழந்தைகள் வேண்டாம், மேபி after 2 years they want a delay actually அப்படிப்பட்ட ஸ்டேஜஸ் நேச்சுரலாவே எப்படி பண்ணலாம். So I want to tell you the first technique. This is called as calendar method. What is the first technique? I'm talking about the natural method, the calendar method. The calendar method where the sexual abstinence on the days when the woman is fertile, and she must be cautious. Actually, the women must be cautious at the time of the menstrual cycle. The calendar method, she must be having the count on days. Actually, every month she must be having the count when actually the menstruation takes place, and the fertility and infertile periods. The calendar method by means of knowing the dates exactly, whether the dates are pre-born or it's getting advanced. She must be extra cautious with this method. This method is called as calendar method. At the time of fertility period, she must be away from sexual intercourse and everything, so that she cannot conceive. She cannot be conceived, so fertilization can be prevented. So this is actually this must be in the hand of the women, right? So she must be marking in a calendar when is actually the fertile period. She must be counting the days actually, the fertile period and the infertile period. Okay, fine. So it is difficult. And what is the disadvantage of the calendar method is, we could say it is difficult to predict precisely when the particular woman's ovulation will occur. Sometimes it may not be so effective, even though she marks in a calendar. We cannot give the assurance stating 100% it will work. It may work for 80%, remaining 20% it may not work sometimes. So we cannot trust completely on the calendar method. So in that way, so this is very difficult to predict sometimes. It may go plus or minus 2 also, where the women should become conceived also. Okay, fine. So this is a calendar method. Next we move on to the temperature. Second natural method is the temperature. By means of the temperature, so you can ask me, sir, how the temperature is going to help. As far as the women is concerned, the body temperature you take, right? The body temperature a little bit slightly increased, actually, slight dip that you take, just by at the time of ovulation, when the egg will start producing out of the ovary. When there will be slight increasing in our temperature, rises day by day, for example 0.5 to 1 degree Fahrenheit, the temperature will start increasing. So how she can also with the thermometer, she can take that, record the temperature. When she can take record the temperature, the moment before she wake up from the bed, she get up from the bed, the moment she wake up in the morning, she has to record the temperature. Before waking up, after waking up, before getting up from the bed, she has to record the temperature, and without taking any fluid or any food, this temperature recording has to be done actually. So when there's slight increasing in the temperature, this shows she is in a fertility period actually. So when you could see actually in this place where you could see the basal body temperature, where you could see it's dropping down, but you could see in the 14th day onwards. Can you see here the 14th day? This is the place where the ovulation takes place. So where you could see the temperature is gradually increasing for the 14th day, and it's maintaining the stationary, somehow stationary. The temperature which keep on going with from the 14th day till the 25 or 26th day, the temperature which gradually will start increasing, right? So this temperature method also seems to be beneficial, which acts like an indicator she is in fertile, women is in fertile period. Okay, so what is actually the problem? Sometimes the women, she is in stress, over stress, But the stress also can increase the temperature. We cannot take the conclusion like just increasing the temperature like always like it indicates the fertility. But thing is like sometimes the over stress like some other reasons also like we can increase the body temperature. So this also have its own limitations. Okay, fine. This is again the temperature method. So we done with the calendar method and then with the temperature method. These are the natural methods when you take. Then you take the mucus method. So this is a third technique that you take, the mucus technique, where you could see the mucus which secreted. The mucus usually which secrete throughout the period actually, like the menstruation cycle, because in the next chapter we're going to discuss about the menstrual cycle, where we'll discuss about the mucus, the secretion of the mucus, where the mucus is getting secreted. The mucus secreted by the cervix, and more mainly what happens, the mucus, like the quantity of the mucus which will be more in ovulation time, where like after ovulations, like the initial point of time, like less than 14 days, like the secretion of the mucus is comparatively less, but at the time from the 14th day onwards, the ovulation you could see, where you could see like this type of or what is that, the mucus secretion that started increasing from the 14th day onwards, where you could see the infertile, where it shows like sticky, scanty, paste like thing this mucus will be. This shows like this is very scanty, is very less amount. You could see this again infertile, by this she can even confirm it. And infertility where like thick, creamy, lotion like the mucus which secretes, again it shows it is infertile. But when you see like wet, but it is wet and it is like purely, it is like it's not like cream, it's like watery kind of thing which comes. This shows it's like fertility period. But most fertile definitely like it will be like egg white. Why egg white? It will be like kind of stretchy kind of thing, like the kind of thing you could see, the thread kind of thing, the stretchy thing that you could see. This indicates like she must be in the most fertile and the fertile stage. But this also like she can confirm if she can avoid the sexual intercourse at this point of time by means of the consistency of the mucus, she can avoid the pregnancy. This is all the natural techniques. She need not take, the women need not take any type of what is that called, contraceptives or medicines or injections, nothing. But we should be extra cautious when they're going for the natural methods like mucus. So you ask the questions like menstrual period, like body temperature of women is high or low. So where you could see like the body temperature increases. I told you like 0.5 to 1 degree that Fahrenheit, like it starts increase after 14th day. From 14th day to 20.24th day, the temperature slightly start increasing. I told you like stress is also like one of the important factor. Maybe some infections if she come across also, the temperature can increase. So we cannot confirm completely by means of temperature. Temperature is increasing, temperature is one of the tool, the natural methods. That is what actually I'm trying to say. Okay, we're done with the part. Okay, fertile and most fertile part. When you take the fertile part, maybe she began with like for example, like you take in a case like 13th day or 14th day. This is what actually you take 13th, 14th day that you can take. Most fertile period, where you could see that the ova, that egg would have reached the fallopian tube. That is the most fertile period where you could see like it's ready for fertilization. At this time, the husband and wife, the male and female, they start having the sexual relationship. Then definitely she'll get conceived. In order to avoid, she can skip this type of sexual relationship at this particular period where she come across egg white stretchy mucus or wet watery mucus. Okay, done. So this is actually the mucus techniques by which this also like we can identify. Okay. Next we come to the other techniques, lactational amenorrhea and coitus interruptus. This you have studied in the textbook itself. What is lactational amenorrhea? Can someone tell me what is lactational amenorrhea? What is lactational amenorrhea? So lactational amenorrhea, where you could see when mom, after that you could see the 6 months following patrician. Following patrician, the first 6 months, what happens like the mom, she'll be feeding the newborn. Other time what happens, she cannot be get conceived. So she cannot be conceived. So that is a place where like when mom she feed a baby, right? So at that time she cannot be conceived for the 6 months of time, especially after the patrician time. She will not be get conceived. So this is a 6 months period. This period is called lactational amenorrhea, the breastfeeding stage where you could see, right, patrician. there will be the lack of menstruation. So the menstrual cycle will not occur for the first 6 months because she's on feeding stage, right? Where there's no menstruation. So at that time, like, she'll not get conceived. So this is one of the place where the lactational amenorrhea, when she is in feeding, she is in a feeding phase where no menstruation takes place. So by that time, the fertilization can be avoided. What is coitus interruptus? The coitus interruptus, actually the coitus interruptus, when you take coitus, what is the coitus interruptus? Where it could withdrawal at a time of sexual intercourse, where withdrawal of the penis from the vagina before ejaculation, before like the sperms, like semen, which comes out, like the male partner is supposed to withdraw the penis out of the vagina before that ejaculation. This is called as coitus interruptus, and this is actually, or what we can do, even after ejaculation, the vagina has to be like completely doused or completely washed, or the vagina has to be like immediately after the intercourse, this has to be properly flushed out, right? So this reduces, but not eliminate. I'm not telling it's a confirmatory technique. Even after the intercourse, like, by means of like, douching or washing out the vagina, out the vaginal part after ejaculation, this can reduce, but not eliminate. This not eliminate the possibility of pregnancy. This will not eliminate the possibility. There are few chances maybe she may get conceived, but this is a natural method. But the best thing is like, withdrawing the penis like at the time of like, intercourse, at the time before ejaculation. This can definitely, we can stop. If like after ejaculation and the women is supposed to be clean and doused and it has to be like showered, like, by means it has to be, it can minimize, but it may not completely eliminate. Okay, so this is actually like, the old technique, of course, the traditional method that you can say, that is the natural method, that is lactational amenorrhea. Clear with this one? So either with the lactation time, no fertilization takes place because no menstrual cycle. When this, you could see like, coitus interruptus, where withdrawing the penis, but means these are the natural methods. You need not go for any pills or any tablets, nothing like that. Natural techniques that you can do it. Okay. Next, we move on to the artificial techniques. So far we done with the natural techniques. Now we move on to the artificial techniques. Artificial techniques. Yeah, coitus. So no fertilization. Yeah, coitus interruptus. If the actually, like, if the sperms are not getting inside, because before ejaculation, the penis has been withdrawn, then definitely the sperms will not go inside, so no fertilization takes place. That is actually the concept behind the coitus interrupting the coitus. So before ejaculation, withdrawing takes place. So no fertilization takes place. Okay, if ejaculation took place, then she has to doubt and she has to shower or she has to wash the vaginal part, and there are minimal chances like, she may get conceived or she may not get conceived. So this is what actually the concept behind the previous part, that is coitus interruptus and lactational amenorrhea. Then if you take, now we move on to the artificial planning technique. Artificial planning technique, here you could see the barrier contraception. So as per the barrier, what do you mean by the barrier? Barrier, which says like, it may be the physical. So here first we're going to discuss about the physical barrier. So what the physical barrier will do? The physical barrier which prevents actually the sperm, which will not allow the sperm to go deeper. So what happens, like, this will not go to the fallopian tube, so fertilization will not happen. You can take an example, but why we go for the barrier contraception? Barrier contraception, you could see in case of, it's a inexpensive, it's not very expensive. The barrier, the physical, I'm talking about physical barrier. Barriers are types of physical, we have like, the other types. I'm talking about the physical barrier first. When you talk about the physical barrier, you could see it's inexpensive, it's very simple to use, like, we not require like any nurse or a doctors to do it. So it's inexpensive and it's very easy to actually use it, and also no side effects, actually very minimal side effects, and no side effects that you could see by means of using this type of physical barriers. You take examples, you take in case of barriers, you could take condoms, you take condoms in case of like, males, that you could see, not only for like, avoiding like, fertilization, but also it protects from the venereal diseases, that is sexually transmitted diseases. This barriers, the physical barriers like condoms or diaphragms that you take, this definitely which can prevent, not only it gives space for a child, but also this is going to avoid any type of sexually transmitted diseases, or we simply call it as venereal diseases, say like an example, HIV, syphilis, gonorrhea. This type of sexually transmitted diseases can also be prevented, right? So for that we can use the cap, the bimule, the wall cap, the diaphragm. These are all things that you can use. But the diaphragm that you can take is then the diaphragm that you can give it for the females actually. But the first time, because the first time when the female, this is for women, diaphragm is for the female. When the female she want to get use the diaphragm, the first time, because the doctors or the nurse like usually they apply this, because diaphragm usually which comes in a different sizes actually. First they'll check the size of actually the diaphragm and they'll fix it. After that the women can use it on regular basis. But for the first time they should get an assistance either from the nurse or from the doctors for fixing the diaphragm. So this is for the females actually. And it should be like, it should not be actually removed for at least 6 hours. The diaphragm, once the women should fix it, right? But the condoms can be removed after the like intercourse. But the diaphragm should not be removed for the minimum, like it should be there for the 6 hours for there, like after the intercourse. After the intercourse, the diaphragm should be there inside, because at that point of time, what happens, because they will be like covering with the spermicidal agents also. Because the 6 hours of time, what will happen? All the sperms will be dead actually. It will be died. So after 6 hours, after the intercourse, after the 6 hours after the intercourse, the diaphragm can be removed from the female. Okay, the reproductive tract actually. So also they can use the cervical cap, the wall cap, the walls that can be used. Here you could see the cervical cap. Can you see the cervical cap here? The cervical cap which blocks the sperms from entering the cervix actually, and there is actually loaded. Can you see here the spermicidal? The spermicidal means it will kill the sperms. When the sperm comes over here, what happens? That is what the reason I told you. Like this has to be there for after the intercourse. Should be there for at least minimum of 6 hours of time. So that meanwhile, what happens? The spermicide which will kill all the sperms. Then after 6 hours, if you remove actually the cervical cap or the diaphragm, this will be beneficial. So this you can do it. So this is a barrier technique that you can do it. So again, I told you just this is actually the condom you can take. The condoms that you can be used, it's used for the males actually. So it doesn't require any so I mean help from the healthcare providers, or it doesn't require that. So but only for diaphragm, the women for the first time it requires assistance from the nurse or from the gynecologist. Okay, and the other barrier methods. What are the things that you could see? Like they can also use along with the cream and jelly. I mean the spermicidal agents that they can do it. Foam, that they have the film kind of film, and they have the suppositories and foaming tablets they have, and we have common chemical agents, like we simply call it as N9. So N9 we call it as nonoxynol. So this nonoxynol is simply called it as N9. This can also be applied onto the what is it called? Maybe a condom, or maybe onto the diaphragm or cervical cap. So this act like a spermicidal agent. This will kill the sperms, even like menfejol, or benzalkonium chloride. We call it as BZK. These are some of the spermicidal, the chemical agents which can be used actually. These are the common chemicals that you can use it. Sometimes these chemical agents can cause some sort of irritation. So, but that type of people, like got some allergy kind of things, like they can very well stop using it, because this is of like chemicals. This may sometimes cause allergic. So for that time, they can go with some other techniques, the contraceptives. Okay, this is a barrier that is chemical. Next, we go. This is very important part, guys. We go to the IUD. From this part, definitely you get one question, definite question, that is intrauterine devices. IUD, intrauterine device. You can talk. Mechanism of action. So this area definitely you'll get one question. So IUDs are classified into 3 types actually. You could see 3 types of IUDs. From this area, this chapter, you definitely get one particular question. You definitely get one question. So non-medicated IUD, copper releasing IUD, hormonal containing or hormone releasing IUD. You must know the examples for each. Can you give me one example for non-medicated IUD? Can you give an example for a non-medicated IUD? Like that, the questions comes actually. Can you give an example for non-medicated IUD? Can you give an example for copper-releasing IUD? Can you give an example for hormone-containing IUD? Yeah. So examples are very important. Definitely one question will come from this IUD part, without which your NEET papers will not be completed. So definitely IUD, this particular chapter, one definite question will come from IUD, that is intrauterine devices. Example for non-medicated IUD, you are correct. Lippes loop. Lippes loop is an example for non-medicated IUD principle. Leads to the foreign body reaction which produces sterile inflammatory response, which is spermicidal. Cidal means killing, which kills the sperms. Examples you take, Lippy's loop is an example. Lippy's loop you can take an example. Copper IUD, copper releasing IUD example. Copper T, CUT, copper 7, you take CU7, multi-load 375. These three examples that you take, CUT, copper T, multi-load. These three are examples for copper releasing IUDs. Guys, this is very important. Copper T, copper 7. You take this is a copper T. The picture that I've given here is a copper T. Yeah, multi-load 375, copper T, and you can take even copper 7. This consists of copper ions. This will be acting against it. So, what is the action of copper IUDs? Where you could see it produces alteration in the cervical mucus and endometrial secretion and initiates release of cytokine peptides known to be cytotoxic. This is actually mode of action of the copper IUDs. Example CUT, CU7, multi-load 375. Examples are very, very important. Okay. Then you take hormone containing IUD. Coming to hormone containing IUD, you take this suppresses the endometrium, leading to atrophy and thickens the cervical mucus, hindering the penetration. So this is what action behind the hormone containing IUD. Example, you take LNG20, and also you take progestasert, LNG20. These are the classical examples. Definitely one question will come from this area. Examples are very important. They may ask anything, non-medicated, or if they can ask copper, they can ask even hormone inducing IUD. Progestasert, you take LNG20. These are the examples for hormone containing IUDs. So this part is very, very important. And this is a picture, the image of the copper T. Okay, we move to the next part. IUD types, just now I told you. So you already given examples. Just in this image, you just confirm it, the examples that you given is correct or not. Non-medicated IUD, then medicated copper containing IUD, hormone containing IUD. Can you see the examples here? Non-medicated Lippy's loop. There are fewer examples they given. See copper T 380A, multi-load 375, copper T 200, multi-load 250. If even this type of options which comes, you cannot get confused. These are the different varieties of the copper T that you could see, the copper containing IUD. And then here you could see the hormone containing IUD. Hormone containing IUDs, you can take, LNG, you can see levonorgestrel intrauterine system, LNG-IUS we call it as, or progestasert. We simply call it as LNG. So these are the examples. This part you should be very careful, and definitely you get a question. So increase the phagocytosis. Exactly, you say that this can increase the phagocytosis of what? Sperms, which will be within the uterus. This is also very important part that you can take. You can take 7 to you can 10 years of time. So IUDs that you can use, exactly you said, this can be used for 7 to 10 years of time. Exactly. Next, you could see the pills and injections. You can go for the pills and injection. So if they don't want, because sometimes there will be disturbing factor, they cannot carry the copper T, and it will be a disturbing factor. Sometimes they'll get the irritation. Sometimes excessive bleeding. Sometimes this irritation may come. The woman, she says I'm experiencing a tough situation. I don't want to go with the copper T and all these things. She can go with the pills and injections. If she's comfortable with the pills and injection, the tablets is quite available right now. Pills or injections also can be taken. So the pills, usually we have two types of pills, mini pills and the combined pills. What is the difference between the mini pills and the combined pills? In the mini pills, it consists of only progesterone. In combined pill, they should take both progesterone and estrogen. So that is the reason, that is the difference between the mini pill and the combined pill. Mini pill, which consists of only progesterone, whereas combined pill, combining means you're combining. So you progesterone as well as estrogen. So this will be in a combined form that you could see. So either the women, she can go with the mini pill, or she can go with the, what is it called? Combined pill. When you take the mini pill, it takes every day. Mini pill, if she is selecting the mini pill, she has to take it every day. And this will actually not suppress the ovulation, but it will prevent the egg from attaching to the uterine lining. It will not prevent, the mini pill will not prevent the ovulation. But what the mini pill will do, the mini pill will not allow actually this come and go with the implantation in the uterus. This is what the mode of action of mini pill. But when you take the combined pill, I told you what is a combined pill. Combined pill, it's a combination of estrogen as well as progesterone. If you take this combined pill, and she has to be taken at the same time, the time duration she should not, for example, 7 o'clock means the time duration has to be maintained, and it has to be how many days it has to be taken? It should be taken for 21 days. Combined pill, there's a time duration. I'm not talking about Sageli here. I'm talking about the combined pill. If she is about to take the progesterone and estrogen in the combined form, that women, she has to take this particular tablet, I mean the combined pill, for 21 days without omitting, and the 7 days will be there, right? The bleeding time, like the bleeding phase, the 7 days she can skip. She need not take this particular tablet. She can stop it. Once the bleeding phase get over, like the menses get over, again she can continue with the thing. You're getting what I'm trying to say? Out of the 28 days, you can take 21 days, like the women, she has to continue taking the combined pill, avoiding only on the 7 days, because that 7 days that you could see the menses, the bleeding phase, she need not take this particular combined pill. Once after the bleeding phase, I mean the menses, she can continue taking without skipping, without the time also playing very important role. So she has to continue as long as she won't have the space for the child. She can continue taking this type of combined pill. This is actually the thing that you can take it. Okay, this is about the mini pill or the combined pill. And when you come for this very important part, this area can get a question. Okay, this is also like orally. Usually the pills usually will be taken in the oral. Okay, oral form you can take. Now this is actually important part. This area also can get a question. Okay, you can take like Sageli. You can take like Sageli. Can you tell me, like who first discovered Sageli? Who discovered, which institute? Who first discovered Sageli? Can someone, sometimes they'll ask this question: which institute and what the year they discovered the Sageli? Because there are many beneficial things that you could see where the Sageli is concerned. Because Sageli, you could see, like the chemical component that you could see is like Sencroman. Sencroman is actually the chemical component of Sageli, you could see. Or here you could see like non-steroidal. That is actually the very important point. You could see like non-steroidal, and it's once in a week pill, once in 7 days, like you can take. CDRA, exactly. Who first discovered CDRA? Can you give me an example, I mean expansion for CDRA? What is the expansion of the CDRA? Central Drug for Research Institute. It's located in Lucknow. Okay, it's in Lucknow. Okay, and what is the name of the doctor actually? Can you tell me the name of the doctor who first found in the year 1961? I believe the 1961 they first identified, discovered this. The doctor and team. I think so it's Dr. Nitya Anand, right? And the team, they first discovered the Sageli, right? And it's actually by CDRI, that is in Lucknow. Okay. So then the question comes like, you can even answer, but the benefits of the Sageli, Central Drug for Research Institute, it's in Lucknow. Sometimes they ask the question, where the CDRI? It's in Lucknow. It's not in Chennai. It's not in Delhi. It's in Lucknow. Okay. But what are the benefits that you could say? Highlights of the Sageli? It's a once in a week pill, and where you could see like in the first 3 months, pill twice, the pill twice per week that you can take. Later followed by once in a per week that you can take. And you could see like it got high contraceptive value. That is very important for Sageli. Sageli has got high contraceptive value. So for that reason only, and also like minimal or no side effects. Mainly like when you take the other pills like mini pill or combined pill, the women, she may experience some type of side effects. But when you take the Maladi or Sageli, this type of the tablets when you take, it's like no side effects, are very minimal side effects, high contraceptive value, need not take every day, it's a once in a week pill. These are the beneficial things that you can take, right? So that is why actually Sageli is highly appreciated, mostly like the women, she can take this type of tablets, like okay, that you can take. Okay, for this you can take, it's a Pure Index 9 is actually a commercial name. Pure Index, actually the commercial, the index which will be given by the ICMR, the code which is given by the each and every prescription they given. That is a Pure Index 9. That is actually given. It will be like in a pearl kind of thing. See, can you see? It is the it will be like the tablet itself will be like a pearl actually. So they given like in a Pearl Index 9. Certain variations also there. So they given the index called the Pearl Index 9 for the Sageli. It's completely oral. It's not by injections. Oral contraceptive pill, and once in a week only it has to be taken. High contraceptive value, no side effects, and it's developed by CDRI Lucknow. These are all the important areas, the points that you should remember when you talk about Sageli. Okay, that is like Sageli. And this is of course you said like it's authorized, like it's authorized by, what is it called? It's authorized by the IMC, the medical council also. Also the treatment for sometimes what happens, like sometimes the sageli which will go, like after the treatment, like sometimes of like gynecology, like hysterectomy, this type of surgery also, like sometimes the sageli can be given. Okay, fine. Next we come to the sterilization part. So okay, it's by ICMR. So it's by ICMR. You say, like ICMR, that I told you already. It's recognized, identified by ICMR. So guys, we're done with this part. The first 1 hour it's got over. So we have the next 1 hour. So now we can take a break. So we have the 30 minutes break. I'll meet you back again by 12 o'clock. So again we continue. We continue with the sterilization technique. Thank you.